Good morning, this is Dr. Afshin Emrani from Los Angeles Heart Specialist. I wanted to talk to you today about a class of medications known as the PCSK9 inhibitors, which are the new class of medications and injectables for the treatment of hypercholesterolemia, particularly for lowering the LDL, which is the bad cholesterol, which causes the coronary artery disease and all the problems with buildup of plaque in the carotid arteries, in the heart, and other places. As you know, the number 1-2 medications in the United States are Lipitor, Crestor, or have been for many years, which are for reducing LDL. There are side effects to these medications, such as elevating the CPK, which is the muscle enzyme, and causing muscle pains and damages. In some people, it's just the fatigue symptoms, and in some people, it's frank pain and goes undiagnosed. Some patients take CoQ10 or coenzyme Q10, which helps with that pain, but sometimes you get even elevations in liver function tests, and anything over 3 times the upper limit of normal, these medications should be stopped. The new medications are injectable. There's two types of medication. One is called Praluent, and the other one is called Repatha. Both of these medications are very, very safe, much safer than the statins. They have special criteria for using them, which means that you have to fail a statin, or even on maximum dose of statin, you still have a high cholesterol or high LDL that needs to be brought down. These medications are very effective. The LDL can be brought down extremely low, even to below the guidelines, which is less than 70 or 60 in people with coronary artery disease, or with people who've had a stent or bypass, or people who have a high risk of coronary artery disease or diabetes, and whose goal is to have as low a LDL as possible. There is really no such thing as too low an LDL. So I have patients that have an LDL of 10 even on these medications. Praluent comes in 2 doses, which is 150 and 75, and Repatha comes in 140. These medications are usually injected by the patient once every 2 weeks, but I have patients that have injected them once every 6 weeks and have had the desired results. Some go once every 3 weeks. It depends. You have to check your LDL and follow up with your doctor and get to goal. And once you get there, you remain very stable. The injection is very easy to do. If you just take the box, you just refrigerate it at the time of injection. You leave it out for about 10-15 minutes so it becomes room temperature, so it doesn't sting. What you do is you remove the top, this top, and then you want to make sure that you put it against your belly or some fatty area, and then you inject with the red button. So this is a demo kit. So I'm going to take out the top. Then this yellow part has to go in order for it to inject. So if you hold it against your belly, you push it in until the yellow part is in. Then you press the button, and you can see that the plunger goes in, injects the medication, and once it pops up, you count to 10 or 5, 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, and then you do that in 2 weeks. It's very easy, non-painful, and very effective. Please talk to your doctor about this important class of medication, which I think will revolutionize cardiology and will eliminate much of the heart attacks and strokes. Thank you.